Anybody who lived through 2020 and was paying attention hopefully realizes that we were all lied to. The government, and unfortunately our healthcare system, lied to us about the experimental gene therapy shots, which we now know not only weren't effective, but were actually harmful. And they did it for one of two things, either money or control. In this video, I'm going to tell you how this is not new, but part of a playbook that is over 100 years old. Welcome to the Trillium Show, where each week we discuss different tips to help you improve your mind, your body, and your life. I'm your host, board certified plastic surgeon, medical director of Trillium Plastic Surgery and Trillium Aesthetics, Dr. Jason Hall. People were pretty interested in my thoughts on AI, and there were a lot of comments about how medicine is being controlled by big pharma. Anyone who lived through the COVID debacle and paid attention to what many physicians were saying and doing can see how deep and how ingrained pharma influence is in American medicine. What you may not realize is that this is not a new phenomenon. The American medical system was actually set up that way. Allopathic doctors, which are the kind of doctors that most physicians that you think about are, the MD, were largely trained spokesmen and salesmen for big pharma. And it's been like this for over 100 years when our modern American medical system was born. The person who conceived and forced this medical system on all of us will surprise you. He wasn't a doctor. He wasn't a bureaucrat. He didn't work for the government at all. It was an oil tycoon. And you all know his name. A little bit of backstory here. It takes us back to the late 1800s. Back then in America, there were really three main types of medical practices. There were allopathic doctors, there were homeopathic doctors, and there were a group of doctors that were known as eccentrics. Now, the eccentrics, eccentric sounds like weird or odd. Eccentric practitioners believed in things like bed rest, plant medicine, steam baths, natural remedies to help cure disease. Homeopaths, on the other hand, which really is a branch of medicine that started here in the States in about 1810, centered on things like stress reduction, personal hygiene, rest, and then what they're known for today is a low dose of natural remedies. Now, contrast that to the allopaths, and allopathic medicine was kind of the conventional type of medicine that was practiced in Europe in the 1800s. It was also referred to as heroic medicine. And the allopaths believed that disease was really caused by the imbalance of four humors in the body: blood, phlegm, yellow bile, and black bile. And they used what were described as harsh and abusive methods to reduce the symptoms, which were typically the opposite of the humor imbalance that was causing the disease. Treatments at that time included things like bloodletting, injections of heavy metals, things like mercury. And mercury is interesting because aside of being in a lot of the shots that had been given to children in the United States up until, still given today, the use of mercury in medicine dates back to the ancient Egyptians. It was used as a treatment for various diseases. And actually, it's kind of interesting. Mercury in the 19th century was used in hat factories to help turn animal furs into felt for hats. And the hat makers that worked in these factories over time would develop something called the Hatter's Shakes, which included emotional instability, hallucinations, tremors, things like that. This is where the term Mad Hatter actually came from, was from this essentially mercury poisoning over time that caused people to kind of go crazy. So those are really the three branches of medicine that were being practiced in the US in the late 1800s. And at that time, there were about 62,000 physicians in the US. 5,500, 6,000 of them were homeopaths, another 2,000, 3,000 were these eccentric physicians, and then the rest of them were allopaths. So they made 80 to 85% of the doctors at that time. Now, At that time in the late 1800s, medical schools really were just getting started. There were very limited, if any, licensing requirements. Training and education really varied widely. Um, Medical doctors, so people that didn't operate, had book training, but that book training was not standard at all. Surgeons, on the other hand, had a lot of practical training. They were trained almost as apprentices, but didn't have much in the way of formal medical education. The allopaths then were trying to kind of take over the medical practice in the country. And the American Medical Association, which started in the kind of mid 1800s, like 1850, 1847, something like that, wanted to come up with requirements to standardize medical education. And this was their big thrust. They wanted to standardize the training and really force the other kind of two branches of medicine into the fringes. They tried this in the early 1900s by, getting the government to try and mandate that 2 years of anatomy and physiology and then 2 years of hospital work be kind of the standard training in the US, but nobody really listened. And actually, another branch of medicine cropped up right about the same time, the chiropractic medicine, which is still around today and is actually fairly popular. The allopaths kind of saw themselves as being in danger of being outcompeted, and the AMA was leading that charge to try and keep them as the focal branch of medicine in the United States. It's important here that we kind of broaden our scope and take a little bit of a broader view at what was going on in the rest of the world. So in medicine in the late 1800s, Louis Pasteur came up with, what we refer to as germ theory, is that bacteria, little microorganisms, are responsible for diseases. And this kind of led to the one pathogen, one bacteria, one disease theory. And you can contrast that with the kind of the way that the eclectics and the homeopaths looked at medicine and disease, something referred to as terrain theory, which is your body is meant to be functioning normally, and disease is caused when there's something wrong with the machinery that allows disease to happen. And these two theories were kind of going back and forth, vying for people to believe the two of them. At the same time, dye companies, clothing dye companies in Germany started broadening, and these companies were using synthetic methods to manufacture their dyes. So they were using petroleum byproducts to manufacture dyes, started using these same petroleum byproducts to make medications. The first were essentially fever and pain relievers that you don't really see anymore, and started seeing a market for synthetic medications. Also in business at the same time, the US government was pursuing antitrust regulations against Rockefeller's Standard Oil Company, which he had built over, some years into a monopoly, which essentially controlled all aspects of the US oil industry: exploration, production, refinery, distribution. And he did that by buying up and essentially eliminating all of his competition. The US government, not wanting a monopoly, was trying to break Standard Oil up, and it took almost 25 years for that to happen. In the early 1900s, though, it was becoming clear that the government was going to win. They were going to beat Rockefeller, and they were going to break up Standard Oil, which ended up happening. And Standard Oil, just to give you a size of what this was, once it was broken down, some of the spin-off companies that came out of that were companies that you may have heard of: Exxon, Mobil, Chevron, humongous companies, just to give you a scope of how big his company really was. So during this time, he began looking for ways and he was a smart guy. He started looking for ways to expand his wealth and find some other way to make money from all the oil that he was pulling out of the ground. And this new synthetic medication trend that started in Germany seemed to be a good idea. And this is where things start to really get interesting. So you've got Rockefeller on one hand, who's at risk of losing his monopoly. You've got germ theory, which is taking hold in Europe. You've got the Germans who have figured out how to make medications out of oil byproducts. And you've got a group, the AMA, who is trying to create essentially their own monopoly on medical education in the United States. What happened here is really kind of interesting. So the AMA creates something called the Council on Medical Education. And they wanted to try and really formalize and lock down the medical education system in the United States. So they went to Andrew Carnegie's Carnegie Foundation and proposed that they set up kind of a joint exploration of the state of medical education. This was kind of all going on one side of things. Rockefeller at the same time had established something called the Rockefeller Institute for Medical Research in New York City, which still exists today and is known as Rockefeller University. The labs at the Rockefeller Institute for Medical Research were led by a physician named Simon Flexner. Their whole goal was to study these new medications and this new germ theory to see if they could kind of work on medications to kill these bacteria and microorganisms that were just recently kind of figured out. And they were successful in doing that. They were able to start to develop drugs to kill some of these organisms. If you have read Sebastian Junger's book, A Perfect Storm, or seen the movie, the book's way better. When big storm cells all come together, the protagonists, which in this case is the American public, is in big trouble. And that's exactly what happened. So the American Medical Association and the Carnegie Foundation hire a guy named Abraham Flexner to conduct a thorough study of medical education in the U.S. Now, if you recognize that name, Flexner, Simon Flexner, was the head of the Rockefeller Institute in New York City. Abraham was his brother, who was a high school classics teacher in Louisville, Kentucky. He knew nothing about medicine and really, arguably, very little about education. So he was sent on a mission and spent 2 years visiting the 155 existing medical schools throughout the U.S. And his report, referred to now as the Flexner Report, was a book-length report that was then presented to the Carnegie Foundation, the AMA, and then was presented to Congress. You can see this online. You can look it up, and we'll leave a link here in the show notes. But the summaries and the takeaway from his almost 350 page report can be summarized in a couple of key points. One is that there were lots of medical schools that were supplying a lot of poorly trained doctors. So they wanted to drastically reduce the number of medical schools and thus the number of poorly trained physicians. They also wanted to align colleges with medical schools and then mandate clinical education for all physicians and hospitals, which isn't a bad idea. And that's how things are done now. They wanted to kind of strengthen the regulation of medical licenses. And then this is really interesting, is they wanted to free medical professors from patient care to permit time for research and instruction. So after this report was presented to Congress, they thought all of this sounded great. And so 2/3 of the medical programs in the United States were closed. After the Flexner Report, there were 55 of the over 150 some medical schools that survived the Flexner Report and were left standing when the rest were closed. Now, if you look at that and you look at the report, there's a lot of racism and sexism that goes into this. Flexner was really hard on medical education offerings for women and for Blacks. And essentially every single women's training program in the United States was closed, and all but 2 predominantly Black medical education programs were closed. Those 2 that still are around being Meharry Medical College in Nashville and Howard University Medical School. Anyway, the AMA got what they wanted, and competition of eccentrics and homeopaths and even chiropractic was essentially eliminated. It went away. So then the question is, we started the show talking about how JD Rockefeller was kind of the architect of this. How did he benefit? Well, what he did was actually really smart. That he decided that now that he was able to create drugs that could, treat some of these diseases that are the result of microorganisms, that if he could control the way the doctors thought, so that now they were, instead of using natural remedies, they were using synthetic drugs, then he wouldn't have to sell anything. So what he did is the Rockefeller Foundation started offering grants to medical schools who would toe the line with respect to this pill for every ill, a single medicine, a single bacteria or microorganism, a single disease theory that had been around then for 15 years. You have to remember, this is a time when most medical schools were operating on shoestring budgets and were just starting to become integrated with the universities they were affiliated with. There wasn't federal money like there is now. There wasn't Medicare. There wasn't NIH, didn't exist. And so these individual professors who were now tasked with being engaged in research and weren't being paid by medical students to be trained were only granted research funds to study the germ theory disease model and push medications that were created out of petrochemicals. Professors who taught prevention, naturopathy, chiropractic, eccentric medicine were labeled quacks. They didn't get any money, or they were just outright fired. Some of those doctors were actually thrown in jail. So practices of medicine that had been prevalent for hundreds and maybe even thousands of years and passed down through generations and generations and generations suddenly vanished. Now, all physicians were taught were allopathic treatment, a pill for every ill, nutrition, sleep, exercise, hygiene, stress reduction. All of those things quit being taught. And these things were looked upon as quackery. That viewpoint still exists today. That is what the medical system in America is today. In medical school, for example, the only nutrition that I ever learned was during my general surgery rotation, and that was how to formulate and mix TPN, which is essentially IV nutrition, which really isn't even used much anymore. Other nutrition in our training was ignored. We just didn't learn it. There might have been 2 questions on a test about how much protein and fat you needed in TPN, but otherwise you never heard about nutrition. Sleep, exercise, stress reduction, those weren't mentioned at all. And actually, sleep, exercise, and stress reduction in surgery training were seen as things that were unnecessary and only for wimps. Now, even in my practice in cosmetic plastic surgery, there isn't a day that I don't talk to my patients about nutrition, sleep, exercise, and stress reduction, either one of them or all of them. But that is learning that I've had to do myself because it just wasn't taught. So you can see that the American educational system that we all know today was really started by 2 groups, the AMA in conjunction with John D. Rockefeller, with the goals of eliminating centuries-old natural treatments and standardizing educational requirements. Now, I got no beef with standardizing medical education requirements. The U.S. medical education system is arguably the best in the world, and I learned a lot from it. And there are doctors from all over the planet that come to the United States to learn. So, I don't have a problem with the educational system. At the same time, though, an entire branch of preventive medicine and centuries-old knowledge has been buried. Rockefeller made sure that these newly synthesized petrochemical medications were at the forefront of every doctor's mind when they were faced with a sick patient, because he paid for the schools that trained them and he paid for the professors that taught them. So when I see comments on my feed that some doctors are paid for by big pharma and they blame Trump or Obama or Bush or Clinton or LBJ or whoever you have to understand that while the politicians didn't do anything to fix the system that we have, and actually many of them broke it even worse than it already is, they certainly didn't create the situation we have today. What we're seeing now is simply the logical conclusion to a system that was created by the Taft administration back in 1910. If you want to check out where I think medicine is going, I'm linked to this video here where I discuss where I think AI is going to take medicine. And unfortunately, it's not a good place. And hopefully I'm wrong, but you can check that out here. But if you enjoyed this show, I would really appreciate you leaving me a review on Apple Podcast. It helps other people find the show. If you have an idea you'd like to see made into a show, you have a question you want answered, leave a comment down below. Shoot me a DM on Instagram or X at Dr. Jason Hall. Thanks again, and we'll see you in the next show.